Thanks a lot for inviting me. My name is Jürgen Rehm, and I'll try to walk you through alcohol-related harms, which means harms which have been caused by alcohol. There are two very broad categories, both harm to the drinker and harm to others, meaning alcohol use can not only harm the drinker themselves, but also others. Within both of those categories, there are two subcategories, one related to health and the other related to social harm. I'll start with health harm. Alcohol use has been found to impact on more than 200 ICD-10 three-digit categories. However, I want to give you a bird's eye view, and I list only broader categories. These broader categories, in fact, three main classes: infectious disease, non-communicable disease, and injury. Let's start with infectious disease. Alcohol causes TB, HIV/AIDS, other sexually transmitted infections, and pneumonia. There are various pathways, but one of the more important ones is the impact of alcohol on the immune system. Next will be non-communicable diseases. We'll start with the various cancers which have been identified by IARC as having the highest evidence that alcohol use has a causal impact of them. There are a number of other cancer categories which have been left out here because they are not yet having the highest level of evidence, but they will probably be on this list in 4 years from now. We follow with neuropsychiatric diseases. Alcohol use disorders is a big category here, and clearly it's 100% attributable to alcohol. Depression and primary epilepsy are other neuropsychiatric diseases which are causally impacted by alcohol. Depression, however, is usually not estimated in comparative risk analysis, neither by WHO nor by the Global Burden of Disease study, because it's so hard to estimate. The causal links go from alcohol to depression and vice versa, from depression to alcohol. And it's very hard to disentangle those two effects. And since we don't have a satisfiable solution, we, to be conservative, left out this condition. Next comes the first condition, which is partly beneficially impacted by alcohol, diabetes. The other two beneficially impacted conditions by alcohol, at least partly, are ischemic heart disease and ischemic stroke. Overall, the causality here is established based on biology. Usually, the impact of alcohol is overestimated, and a very few drinking is necessary to create those beneficial effects. In fact, one drink every other day would suffice to create those beneficial effects. And obviously, if you drink way more alcohol, there would be negative effects also for those disease categories. The other cardiovascular diseases which are impacted by alcohol in a negative way, meaning detrimentally, are hypertensive diseases, cardiomyopathy, atrial fibrillation and flutter, and hemorrhagic stroke. Next come the gastrointestinal diseases, liver cirrhosis and pancreatitis. Liver cirrhosis is a primary alcohol attributable outcome. More than 50% of the liver cirrhosis around the world have been caused by alcohol at some stage, meaning a lot of other liver cirrhosis, which may have been originally caused by hepatitis, are then affected by alcohol in their course because alcohol is in fact affecting all kinds of liver disease. The fetal alcohol syndrome is a poignant reminder that alcohol does not only affect the drinker but also others, but that's not part of this lecture. So I will go directly to injury, and all kinds of injuries, intentional injuries, unintentional injuries, including suicides, have been found to be causally affected by alcohol. The burden overall is high. The Global Burden of Disease study has come up with an estimate of 2.4 million deaths, the vast majority of those deaths in men. And according to them, about 24% of the alcohol attributable deaths would be due to communicable diseases and injuries. A recent WHO-associated study found even higher mortality, with a total of 3 million attributable deaths, including much higher numbers in alcohol-attributable injury. The social costs of alcohol use have been estimated to amount to 2.3% of the gross domestic product, and this includes social and health harms to the drinker. However, it does not include most of the harms to others, and thus even that high number, the 2.6% of the gross domestic estimate as an average across all studies, is an underestimate because most of the costs for harm to others has not been included. Alcohol is the most important risk factor globally for people under the age of 40. Meaning that alcohol overall is proportionally affecting younger most. That doesn't mean that most alcohol-related deaths are in young ones. It means that the proportion of deaths amongst the young ones is higher than the proportion of alcohol-attributable deaths amongst the older ones. However, that means that deaths is a bad indicator for alcohol because most of those deaths are happening so early. And a good indicator for alcohol would be years of life lost or alcohol attributable life expectancy. So these would be measures which would take into consideration not only that there is a death or a disease, but when it would happen. The burden also is not evenly distributed. Alcohol clearly causes more harm to the poor than to the rich. And this is true per liter of alcohol. It is true both on an individual level. We speak of the alcohol harm paradox, which means that among poor social strata, the same amount of alcohol use causes more disease and social harm than in richer social strata. However, it's also true between countries. In high-income countries, the harm per liter of poor alcohol is lower than in low and middle-income countries. So we have a phenomenon which is not only on the individual, but also on the country, on the societal level. Alcohol, the same amount of alcohol, impacts on poor more than on the rich. There are many reasons for this. First is, of course, that there are different disease categories and causes of death which are associated with wealth. Consider, for example, tuberculosis. Very clearly, tuberculosis is quite rare in high-income countries, but also in rich people in lower-income countries. So tuberculosis is a disease of the poor, and very clearly alcohol attributable tuberculosis also is mainly in the poor. And that's one of the reasons why alcohol has more harm per liter in the poor than in the rich. Another reason for this is the interaction between alcohol use and other risk factors. A lot of those risk factors, tobacco, overweight, air pollution, and fewer medical services, are more prevalent in the poor population, and thus the same amount of alcohol interaction with those factors creates more harm, more problems with health. Here is a graph which basically shows you the distribution of alcohol-related attributable deaths all over the world. You see that Eastern Europe and parts of Africa have the highest rate of alcohol attributable deaths. This is important because overall those countries have the highest deaths, but not necessarily the highest proportion of alcohol attributable deaths. Here is another slide which shows you the impact on different levels of countries. Look at the first slide, in the first category, tuberculosis. You see, you can't even detect it in the high-income countries as a category. The richer the country gets, the more you see alcohol affecting it. Another one would be road injury. This is the interaction between the roads and the how well the roads are and alcohol. And obviously, the roads are quite safer in richer than in poorer countries, and that is then reflected in alcohol attributable traffic injury. Another reason for that is that in cars, there are usually more passengers in poorer countries, meaning that a driver who is driving drunk will have more victims. We are now going into the social harms. The social harms are quite a lot of quite different categories. If you make surveys, most people consider the following four harms the most important ones. Violence. Alcohol has been shown to biologically impact on violence. And that is not only a harm to others, but also a harm to the drinker, meaning that people who consume a lot of alcohol are also have a higher chance to become victims of violence. Alcohol also is responsible for public disruption, for financial losses, and for work-related consequences. Quite a lot of the work-related consequences affect the drinker themselves, but of course, in most of those social categories, there are also harm to others. And as I indicated, Tasha will have a whole presentation on this. This brings me to my conclusion. Overall, the burden of alcohol comprises health and social harm. Harm caused by alcohol is high for the drinker, for his environment, and for society. It's also costly to societies. All of the categories which I've spoken to you account for about 2.5% of the annual GDP on average in all countries globally. Obviously, this is only true for countries who made a social cost studies. Alcohol affects a lot of disease categories, The most important ones of them are cancer, cardiovascular disease, alcohol use disorders, and injury. Alcohol-attributable health harm comes early in life, and alcohol, as we've seen, affects the poor more than the rich. All of those facts give a very, very strong reason to limit the future harm of alcohol, both to the drinkers and also to others. And alcohol policies make an important role here. Thanks a lot for your attention.